It's not looking good, Donald. Donald Trump's health appears to be just rapidly deteriorating before our eyes. Every day it seems to be getting worse. Yesterday, a press conference in the Oval Office where he again fell asleep, and that followed that bizarre manic episode he had in a national address where he just started like shouting and yelling at this pressurized speech. And a lot of medical professionals are out there now saying something is seriously wrong. Finally, the media is covering it. I mean, you got an article from the New York Times saying it was one thing when Mr. Trump called a reporter piggy or casually threatened to put a half dozen members of Congress to death or labeled all Somali immigrants garbage. But now, many in Washington are wondering if the leader of the free world has lost it. David Rothkopf goes, I have some thoughts. Trump's televised manic episode may have set new world records for lunatic, mendacious vapidity, and more. You know, and Donald Trump's holding these holiday events where he keeps on like begging for some assurance that it's going to be okay. I'm healthy, right? I'm healthy. No, Donald, you're not. And he's shouting out to his sycophants like Dr. Ronnie Jackson. I'm healthier than Obama, aren't I, Dr. Ronnie? Ronnie, I'm healthier than George W. Bush, aren't I, Ronnie? Yes, Donald. Yes, Donald. You want to take another cognitive exam, Donald? Would you like to take another Montreal cognitive dementia test, Donald? Here's Donald Trump saying that at the holiday party. Here, play this clip.
But Doc Ronnie, the reason I like him, he was a doctor, the White House. He took care of Bush, took care of Obama, took care of Trump. And the fake news right over here, they said to him, Doctor, could we ask you a question? Yes. What would you like? Who's the healthiest, Bush, Obama, or Trump? He said there's not even a contest. By far, the healthiest is President Donald J. Trump. I said, I love that guy. That guy is great. I'm sure that Bush and Obama don't feel the same way, but who the hell cares, right? But I want to thank you, Ronnie. You've been great in every way, and you've been a great congressman, and you're not a congressman that I had to call. I never had to call you at 2 a.m. to get your vote, did I, huh?
Now, folks, a very well-respected doctor, cardiologist by the name of Dr. Jonathan Reiner. Again, he's a professor of medicine, surgery, interventional cardiologist. He's Dick Cheney's cardiologist. I mean, this guy knows his stuff. During Donald Trump's manic speech, the national address that left Americans horrified, Dr. Reiner said no one should be happy to see a president like this. He looks unwell. I'm seriously concerned about the health of this guy. The pace of this address is absolutely manic. And we're seeing so many headlines like this today. This from The Guardian. What's going on with Donald Trump's health? And you saw him yesterday in the Oval Office fall asleep. Watch as his face droops as he struggles to stay awake. Here, play this clip.
And if you don't have standardized dosing, any study that you do is comparing apples to pears. And we don't know the difference between.
I could show you many more clips like this. I'll just show you one other really short one of him falling asleep. He was sleeping through most of this event. Here, play this clip.
Stand number 3, who is a danger? And it is knowledge that will allow us to optimally take the benefits that may be behind cannabis as research.
And that followed what we saw the night before. The night before, Donald Trump just started screaming, the Democrats, ah! And people are like, dude, this is a national address. Like, God, what are you even talking about? Why are you holding this? You know, it was like watching somebody in a psychiatric ward. Here, just take a look over here. Let's play it.
And you see that now in the steep increase in premiums being demanded by the Democrats, and they are demanding those increases, and it's their fault. It is not the Republicans' fault. It's the Democrats' fault.
Now, let me show you. Dr. Reiner was on CNN with Jake Tapper yesterday. Here's what he said.
So he's done this several times now in the last few weeks. He's fallen asleep in a crowded Oval Office, and he's also fallen asleep at cabinet meetings with people talking directly to him, and that's what's called increased daytime somnolence. And there are a lot of things that can do that. Sometimes people with sleep apnea, people who wake up many times during the night and don't get restorative sleep, have that. that's treated typically with CPAP mask. We've never been told the president has sleep apnea. But it's jarring to see the president go from basically asleep in the Oval Office to, really this rapid fire pace, during basically a 30-minute speech that he gave in 18 minutes. It was, and again, what I said last night is no one should be happy to see that. Certainly his supporters shouldn't have been happy to see him so sort of loud and almost out of control. And his detractors should not be happy to see him. The president of the United States should be well, but there've been a lot of health issues. He has the chronic bruise. He had swollen ankles. He's had these mysterious scans. We mentioned the daytime somnolence, and then last night's speech. So I think all of this raises realistic concerns about the health of the president. And it would be great if the White House was a little bit more forthcoming about that. I can't be the only person who had concerns after watching him last night.
You weren't.
Here's more from Dr. Reiner right here, renowned cardiologist. Here, let's play this clip.
Well, it wasn't the content. I thought the content was just standard fare that we've become accustomed to, but it was the way it was delivered. It was delivered in with a manic cadence, almost a frantic cadence. It was as if you felt like you were listening to a podcast on 2X. And that kind of manic delivery was very, very disturbing, very pressurized speech. And as the address went on, the cadence of his remarks became quicker. And we've never seen the president, like that. He seemed almost frantic, and it was disturbing to watch. It was disturbing because he's the commander in chief. He's not just the head of the government. He's the commander in chief of the greatest armed forces this world has ever seen. And it was disturbing to see him in such a almost uncontrolled cadence.
Now I want to bring in Dr. Vin Gupta, the leader of Meidas Health. Dr. Gupta, great to see you. I know I showed some clips right there of Donald Trump both having this manic episode during this bizarre address to the nation, then in the morning crashing out, yet again falling asleep in the Oval Office during a press conference. You and I have been on this beat reporting on about it for some time. It's certainly now very prominently being reported on with other media outlets saying there's something wrong with this guy, and it's obvious that it's getting worse and worse by the day. What do you make of it all, Doctor?
Just what we're observing is it does seem like he's having rambling, incoherent episodes where he's talking very fast. Some call it pressurized speech. It's incoherent moments of rambling. One wonders, is this really different from how he's been over the last 10 years? That's for everybody to make their own determination. But as somebody, and I should qualify this, I have not examined him. We're all wondering and asking questions, what's going on? But it does seem like, for example, last night, it was a difficult speech to follow. There was moments of pressurized speech. He was talking very forcefully, very fast. It was hard to understand. Word choice, it didn't make a lot of sense. And it was incoherent. And when you couple that with the fact then he is clearly visibly fatigued for a lot of his actually waking in office time, you do wonder, is this just normal signs of aging or is something else going on? And I'll just add, again, questions that we have. One, we've talked about this. Why did they only release MRI findings of his torso, so chest and abdomen? That doesn't make a lot of sense. You never just get an MRI of the torso for preventive screening purposes, if that's what they're claiming. Now it's in vogue for some people to, hey, let's get the full body MRI. So if they did that, why are they just presenting in the torso findings and not just the findings of the full body? Is there something that they're hiding? Again, a question that we're curious about. Why the torso? Doesn't make a lot of sense. And then it does look like there's actively, I've now seen multiple photos of this longitudinally over time, Ben, of his hand, where it does appear that they're putting makeup or some coloration on his hand, maybe in some cases bandages in the past. Is there something that's happening with the hand? Is he getting an IV for medication. Questions, again, that it would be helpful to get transparent answers to. But of course, given what he's demonstrating publicly, pressurized speech, rambling performance, I don't think anybody would call that articulate or eloquent, certainly coming from a president. When you couple that with obvious signs of fatigue more frequently, and then the fact that there's these one-offs, what's going on with the hand where we would typically put an IV if you're getting a medication via an IV, and then why just the MRI torso findings, doesn't make a lot of sense. And it causes, I think, reasonable people to ask questions.
Why at someone that age or any age would you get an IV in that area versus an IV on the arm or somewhere else? Like, just again, we don't know specifically what happened to him, but what would be the reason of that location to do an IV?
Well, I think that's just an ID. That's a common area where, for example, I would access somebody's vein to give them a medication. It could be the arm, it could be the wrist, but that part of the hand is a common place that if somebody's getting a regular IV for whatever reason, you could easily commonly put it there because a lot of people can actually see their vein. So in theory, for a medical provider, it should be easy and less painful to access.
I guess my question there too, though, just from someone who's not in the medical field, is that, like, obviously Trump wants to try to hide it. So if there was a vein somewhere else that could be hidden under his suit, he would go there first. So is there, though, like, when you search for a vein or when someone searches, is there a reason why, maybe whether it's age or whether just not finding a vein, that you would look places, or maybe you tap out of veins that you've done in other places, and so you don't find a good vein? Why would it
do
be
that?
there versus another place?
You summarized it beautifully. Either the other veins have been tapped out, are hard to access, IVs are not easy to start, and it could be now that the veins that are visible on his hand are the easiest to access at this point. So something that's more discreet that could be easily hidden away from the press view or from a camera's angle, no longer possible to access. And so this is just the easiest point of access at this point. That would make sense. And yet it does appear that something odd is happening there based on the fact that there seems like there's an effort to cover something up. Again, asking questions. But when you couple that data point with then all these other data points, Ben, I think you and I and others are asking the right types of questions, and we deserve answers because his public performances, when you speak even privately, when I speak privately to physicians that might be on other networks or might have a different set of beliefs, I don't think anybody would look at last night's performance and say that that was normal.
Right. So look, 3 data points in particular, and let's talk about kind of Trump's response. Data point number 1, this advanced imaging, this MRI. Trump claims preventative abdominal. You've said, look, I've spoken to the top radiologists in the world. You don't do preventative abdominal MRI. I'm going to let you respond to all of it. So that's data point 1. Number 2, cognitive exams. This Montreal cognitive exam. Trump says he takes them frequently. I think you've come on the show and you said that's not a normal exam that you take frequently unless there is, serious cognitive issues. And I'll let you kind of hit all 3 points. And then the other one is the hand, the explanation that Trump said that the White House is giving is lots of handshakes. And they say, that's something that happens. And then Fox had someone who show up who said, look, A-listers who shake a lot of hands, that happens a lot when you shake so many hands. And so to take all of that together and kind of tie it together for us, because those are their 3 answers to each of those things.
So number 1, advanced imaging, you do not get out of nowhere just an MRI of your torso, your chest, and your abdomen, and present those results from the White House physician and act as though that's a normal screening tool. There are some that believe that a full body MRI in this day and age, if you can afford it, is appropriate to do. Reasonable people can disagree. If that's what actually he did, then present the results of the full body MRI. But there's no reason whatsoever, especially if they're saying he's the chief executive of the United States, just to limit it to the MRI of the chest and the abdomen. Nonsensical. Number 2, at the Montreal cognitive assessment, this tool to assess whether or not you have early signs of dementia through understanding whether or not you can recall 4 words, very basic type of test. This is not something that you repeat frequently unless there's a neurologic reason to do so. If there was a neurologic reason to do so, fine. In certain cases, you repeat the test. But if you're otherwise claiming to be normal, you're not repeating the Montreal Cognitive Assessment as often as he's claiming to do it, as though that's some sort of flex here. It's not. And I think he's being misdirected, or he's just reading something and is being misinformed by himself. And then 3, lastly, just the fact that how he presents himself, whether it's the hand, is there something happening with that hand? Is there an IV there that they're trying to cover up? His pressurized, rambling, incoherent speech. When you take it all together, reasonable people are asking reasonable questions. These are not political questions. These are basic medical questions that if they had a doctor that was not trying to editorialize and actually just present the facts, these would be reasonable questions to get answers to. And yet we're not seeing that.
Just before you go, the handshake. I mean, she's saying that, have you ever heard in your career of someone that the explanation for what you've observed is so many handshakes that, of course, that leads to that appears. Does that make sense to you?
No, handshakes are not a risk factor for easy bruising. And again, if we're claiming that that's the case, that's concerning. And I would want to know if somebody's bruising because of multiple handshakes, it would prompt the question, is something wrong? And let's make sure nothing is wrong with, say, that person's ability to clot their blood. Do they have some sort of disorder that's causing them to easily bleed? Because a handshake should not be a risk factor for frequent bruising. So no, that's smoke and mirrors, and that's not explaining it.
Dr. Gupta, thanks for your time. We appreciate you. We appreciate your leadership at Meidas Health.
Thank you, sir.
Everybody hit subscribe. Let's get to 6 million subscribers.
Love this video? Support independent media and unlock exclusive content, ad-free videos, and custom emojis by becoming a paid member of our YouTube channel today. You can also gift memberships to others. Let's keep growing together.